Now, why this is important is because when we look at the cells, all those little round things that you're looking at, whether it's light or dark field, those are red blood cells. And their job is to actually pick up oxygen from their surface area, from the lungs, and then they deliver that oxygen to the tissues. And then in the tissue, they pick up all the waste material from the cell's metabolism, and then they deliver that out the organs of elimination. Well, it would make sense to know that they need their surface area to be available, kind of like if you took a tennis ball and you dumped an individual tennis ball in a bucket of water, all the water is touching around that tennis ball. But if you pack in all the tennis balls you can possibly fit in that bucket, then the amount of water that's actually touching an open membrane isn't that much. And that's what's going to be a problem, and we're going to discuss that. If we use it in a way to be able to look at the morphology or the condition of the red blood cell, we can see free radical damage, we can see parasites, bacteria, and yeast, and we can see undigested proteins and fat. We also can see anemia. But the most important part that I use it for is to evaluate the fourth phase of water. Some of you out there who took science a long time ago, you're going to immediately say, what is she talking about? There's 3 phases of water. We learned that in school. No, there are actually 4, and I'll get to that on the next slide. But we talked about why these red blood cells are so important in order to deliver oxygen and get rid of waste material when they can use their surface area. This is a condition called rouleau, and I never really understood what was causing this, and Dr. Winter and I were taught that rouleau is normal in horses and cats, and I will tell you emphatically it is not. In fact, I posted a case in a technician group, and some guy actually made the comment, oh, rouleau is normal in cats. And I'm thinking, wow, a belief system? Yes. The truth? No. Because I can make this go away in a multitude of modalities in horses and in cats. So it is not normal. This is even worse than rouleau. This is almost called aggregation. And those are all supposed to be nice round blood cells. And you can see that they look more like cuboidal crystals and not a real white blood cell. This is a slide of an animal that has anemia. And the way we know that, scientifically defined, is that we have a lot of large cells and then we have a lot of small cells. And there's not that many cells on this slide. And by the way we make these slides, we take a fresh drop of blood, we put it on the slide, we put a cover slip, and we read it under 100x oil. So we're not adulterating it or staining it or doing anything else. We're really looking at the morphology of what's there. Now, the work I'm discussing is coming from Dr. Pollack, who is a very well-respected scientist at the University of Washington. And he's got tons of TED Talks. He's got a lot of stuff on YouTube. Again, very well-respected scientist who has really helped us understand the fourth phase of water. The fourth phase is a gel phase that lives between the liquid and the solid. And then he defined the space around the cell or the organelle as the easy water. And he called it easy water because it's the exclusion zone. And what happens is when this cell in the center, the little round part was called a red blood cell, it forms this structured water or fourth phase water, which is a negatively charged phase. When it is expanded, it pushes all of the positive solutes into that bulk water. This is an extremely stable configuration, and that's how he's able to explain surface tension in the water where bugs can walk across it, and also why clouds are able to stay together without dispersing. So this happens in our body. But when we are exposed to things like PEMF, toxins, hormones, chemicals, pesticides, many things I've seen just crush that fourth phase of water, contract it down, and now the cells can no longer separate from the other cells around it, and that's when we see rouleau. So now we're going to show you a couple of cases. This was a cat that was very, very sick when it came in, and on the left, it really kind of looked more like a mosaic of crystals. It didn't even look like blood. We used our PEMF device. On the right-hand side was after 1 hour. and it still has rouleau, but at least we can recognize the cells now. This was before day 2 treatment. We did 4 consecutive days. And then after day 2, we could start seeing some individual cells, but it wasn't great. The magic was after our 3rd treatment. So we saw the blood right before we did the treatment, and then after the treatment, we had full cell separation. We did day 4, the blood remained looking good before and after, and then we checked 3 weeks later and it continued to look that good without further treatments. Little Suki went to a referral center for very severe vomiting and diarrhea. Liver enzymes were off the chart. They said Suki had severe liver disease. He probably wasn't going to live. And they got the vomiting and diarrhea under control. And then the referral center said, you need to go find a regular vet to continue the care. So Suki comes to me, and this was Suki's live blood. And you can see in the background, there is a bunch of bouncy stuff. That was fat that wasn't being digested. And Suki had been fasted already for 7 hours. So that should never have been there. Lots of rouleau, lots of fat in the blood. When I checked the triglycerides, they were 2,514. And that is exceedingly high by anybody's standard, human or otherwise. So we started doing a diet change. We started adding some enzymes, but really in one day, how much are you going to get done? And we used our PEMF device. And we can see that in the background, there is about 50% reduction in fat. He's still not fully converted over to a raw diet, but we're moving in that direction. And the cells look markedly better. Day 2, I didn't get the live blood done. This is day 3. And when I play this, pay attention to the background. There's some yeast in the background, but there's nothing bouncing around. And the cells look beautiful. In conjunction with that, we see clinical changes in the gut, which is cool when you're able to take something tangible and see the changes under a microscope and then correlate that with how the animal is changing. You know that's not just in your head and you're not making it up. So we started with triglycerides at 2,514 with all the fat in the rouleau, and 1 week later, this triglycerides were down to 125, which is normal range. We used no drugs. I'm always looking for technologies and tips and tools that can help my patients get healthier, faster, and these towers are quite amazing. And EMF is just really one of the most devastating things that are affecting our animals. And, you know, I've got tons of computers all over here. We have a lab full of equipment. We have technology monitoring and surgery. So they are inundated in an EMF field. Having these technologies inside which can help mitigate all of that for these animals is really priceless.